With Christmas behind us, people are flocking to get tested. The latest data show many people spent their holidays in a hospital bed. Let's go straight to our friend Evan Kozlov, who's here to verify the latest numbers. Hey, Evan.
Yeah, hey, Mike. We're able to get up-to-date info on all this because the Department of Health and Human Services has this portal right here where they break down the number of hospital beds that are full at any given moment. And here are some of the top line numbers. We're going to circle it for you. First, 58,073. That's how many ICU beds are in use nationwide, which is just under 75% of all ICU beds. Let's move on to that next number. We're going to circle it here on the board. 15,797. That's how many COVID patients are in those beds, or more than a fifth of all the ICU beds that are out there. So let's go a bit deeper and look at the local numbers.
We are going to see hospitals that are going to say we have no more room.
Bob Atlas is the president and CEO of the Maryland Hospital Association. He's one of our sources for this story, offering context to that data from the Department of Health and Human Services. And Maryland hospitals are filling up. According to HHS, nearly 82% of inpatient beds are currently in use, and nearly 72% of ICU beds are in use. But Atlas says that the situation is even more dire than that due to a growing staff shortage.
People have left the profession or they've been sidelined for one reason or another. And they're tired. They're really tired.
In fact, he says that when you look at staffed beds, meaning those with adequate medical staff nearby, the real capacity for ICU beds is closer to 90%. Next, let's talk about Virginia. According to HHS, over 71% of their inpatient beds are in use and nearly 72% of their ICU beds. And in D.C., 64% of beds are in use and nearly 76% of their ICU beds are taken. The D.C. Hospital Association said that they're monitoring the numbers, but believe that at this point, D.C. hospitals, quote, remain sufficient to care for patients.
This is not a time to be celebrating with in crowds with masks off and treating it as if it's not real, because it is very real.
Continue to take this all seriously. That's his message there. We also heard from the American Hospital Association tonight, a spokesperson saying they are very concerned about the spike in hospitalizations, in particular because of the workforce shortages. They're asking for our help, urging folks to get vaccinated and boosted if they haven't already, and to keep wearing those masks to stop that spread. Mike?